The Big Picture. It's 9:15 on your Thursday morning. Thank you for joining us. I'm Bryn Caswell.
And I'm Colin Dorsey. Great to have you with us following that live coverage of the weather going on. But right now we are joined by Ohio Department of Health Director Dr. Bruce Vanderhoff. Dr. Vanderhoff, thanks so much for coming in.
My pleasure.
Hopefully the rain wasn't a trouble for you.
No, I didn't have any difficulty at all.
Okay, well, it's obviously back to school season.
Yes.
We're talking about vaccination rates for Ohio students. Lower kindergarten vaccination rates this year. What are the reasons for that in the data?
You know, it's a really good question. And the bottom line is, I think what we're seeing is much less a problem of parents being against vaccines and more an issue of parents wanting more information. They want to understand a little bit more. They're hearing a lot about vaccines, and they just want to know more about the vaccinations that are recommended for their child.
And there's so much to weed through out
Yes.
there nowadays.
Yes.
I mean, parents are getting, bombarded by stuff they see on social media. They're taking a lot of things that they see in these social media threads. I see it in various community groups all the time. For new parents especially, how do they weed through what is fact and what is not?
Well, I'll tell you, I think their best resource is their child's healthcare provider. And I've been encouraging for quite some time conversations between parents and their child's healthcare provider. Because, look, your child's healthcare provider, like you, is your child's advocate. They want what's best for your child. And they understand the science. They understand all the research. They've got clinical experience. So I think engaging them in conversation is just a great way to learn more about the vaccines and get your questions answered.
When looking at just what we've experienced the past year with measles across the state, those vaccination rates are pretty low in Ohio. Is that disheartening?
Well, it's concerning. And I'll tell you, what we've seen is that prior to the pandemic, we were around 92.5% of kids entering kindergarten having demonstrated they were fully vaccinated against measles. We saw that drop continually, such that last year we were down to just around 88%. Now, the reason that causes us concern, we've got great illustrations just looking at the case numbers in our state. And this year, we're going to exceed last year's numbers. We're going to have, right now, we're at 69 cases. And measles is not a pleasant illness. Measles really makes kids sick. And sadly, a small percentage of them will in fact die.
Mm-hmm. And when looking at the updated guidance from the Trump administration regarding vaccine requirements for children, on the Ohio Department of Health website, the schools require the measles vaccination, correct?
That's correct.
Can you speak to that and why that decision has been made?
Yeah, so it's important to recognize that the president's order did not eliminate the measles vaccine. In fact, the order, if you read it carefully, is emphasizing first the importance of parents' autonomy and parental decision making, that vaccines should be given as a result of informed decision making. Well, you know what? In Ohio, we've always been in favor of that. We've talked about that before the president was talking about that. So that is consistent with practice here in Ohio. The other thing that the order points to, though, is recommendations about some of the spacing of vaccines. But the science hasn't changed. And so when we look at the importance of our vaccines, another thing I looked back at was, I said, well, what was it like in Ohio before the measles vaccine? And I looked at a 5-year period, and what I found was prior to the measles vaccine, we would report thousands of kids every year who would come down with measles and hundreds who would die. And can you imagine your perfectly healthy child coming down with measles and dying? Today, it's unthinkable. And that's really a testimony to the incredible efficacy and safety of a vaccine we've been giving for a very long time now.
And it's not just, talking about the severity of measles, as well as because there are a lot of people out there who are old enough to remember the polio epidemics before the creation of that vaccine.
Yes.
And now wild polio doesn't happen.
Absolutely. I'll tell you, I have colleagues who suffered from the consequences of polio. A colleague who had a great difficulty with walking, another colleague who had lifelong difficulties with breathing as a result of them having had polio before the vaccine was available. And I remember stories. My father recently passed away, but he would tell stories over and over about how people in his neighborhood, when a polio case would happen, there would be great fear. And when the vaccine came along, they were lined up around the block to get that vaccine.
Right.
I mean, I even think back to COVID when that vaccine first came out. People were going to their health departments trying to get in line to get those shots. I mean, those lines were so long. Let's switch gears now, talking about cyclosporiasis.
Yeah.
Give us an update on those numbers.
Sure. So we saw more cases of cyclosporiasis than we have in a very long time here in Ohio. And fortunately, we're seeing those trends on the decline. We are still seeing cases, but we are definitely on a downward trend. We right now are at close to 6,000 cases that were reported overall, which is really quite a lot. And while we're really happy to see the cases declining, the fact is that cyclosporiasis is just one of many organisms that can cause foodborne illness. And what happened this summer with cyclosporiasis is a reminder to all of us about how we should be handling our fresh fruits and vegetables every day. And when you bring them home from the farmer's market or from the store, you just don't toss them in the fridge and use them. You need to wash them. And we've forgotten that. I think that it's really something that our parents or grandparents may have done that we've kind of forgotten to do. Well, this was an illustration of how important it is with fresh leafy greens and certain fruits to wash them.
And I know agencies like the FDA and the CDC have been very involved with states during this whole outbreak. How has that been, how has that worked with these federal agencies?
Well, as you can imagine, with the number of cases that occurred in Ohio and the work that the Department of Health does to trace each and every case so that we can try to find the root cause, there was a lot of work that had to go on there. Well, we reached out to our colleagues at the CDC, and they were able to send us several people from their epidemiology team who moved to Columbus for about 4 weeks and helped us with that work. So we're really grateful for the help that we got from the CDC.
Do you know any of their findings so far about kind of the tracing of this, where they think it was coming from? I mean, Taylor Farms kept getting thrown around, but for Ohio specifically, in these cases that you guys have been tracking, where do you think it's coming from?
Well, it really does appear that there were strong signals related to lettuce. And our messaging about the importance of particularly washing lettuce, iceberg lettuce in particular, seems to have been a particularly strong signal. But I don't think that our data was such that we could say it was just lettuce. Again, the important message really is there's a way to avoid this. While this is an organism that usually comes from tropical to subtropical areas, can occur in Ohio, regardless of where it came from, we know how to avoid it, and we avoid it by washing those fresh fruits and vegetables.
So the threat of cyclosporiasis and getting that still very much prevalent today?
Well, there's still some, but it is rapidly declining. And that, by the way, is also typical. This is when we see it, we usually see it most in the summer.
Okay.
Anything else going on at the state right now in the public health world that we should know about?
Well, we have always lots going on. I think the one thing I would say is we're trying to get more messaging out about the importance of avoiding cannabis use during pregnancy. And there will be more coming from the Department of Health and some of our partners about the importance of safe pregnancies, including avoiding the use of cannabis.
All right, we'd love to get you back on about
Yeah.
that.
Thank you so much.
Yeah, thanks. Appreciate the time.